Hello everyone, my name is Adam Shkoda. It's my pleasure to be in front of you. This is something I'm really truly proud on because this is the reason why I joined this movement. This presentation is gonna be heavily scientific, but it is the core mission what we do. We are improving people's lives, we are inspiring change in life. What we do, we are really improving public health, and this tool is unshakable, it's proven, and it's the best what you can tell, what you can share, and what you can do to yourself. How do we know that? How can I be so sure? Very simple. This is the original balance all concept, okay? It's a balance concept. How do we know that? We know that because we bought this concept from scientists from Norway. We have a test, we have a report and dietary advice, and we have dietary support. Everything has been already approved that the combination with fish oil and olive oil is something what gives us enough EPA, DHA, and also other acids and polyphenols what we need from our diet, but our diet is very poor on those. That's why we are doing this balance concept. Okay, so we know that this dry blood spot testing, where we send the samples to Norway, to the laboratory, one of the best laboratory in the world. This laboratory is partnered with Harvard, Cambridge, Oxford, and other big research companies. So we know that we cannot do mistake with this one. And we also know that we analyze more than 1.5 million tests so far, and we are growing this number every single month. So balance test is about measuring fatty acids. We have 11 fatty acids, which is basically 98% of all acids in our cell membranes. And with this thing, what you can see from this test, you can be very sure that things what you do can be improved, or after balance concept use on yourself, you will see that you are there already. So there are some percentage of everything. We have some biochemistry, how we actually are using those in our body, and we know that if you measure this for yourself, this will be very complex analysis of your blood cells. What is the origin? Is it ours origin? Not really. The origin comes from Professor William Harris. He is quite famous. He is more than 50 years in this area. He is the world expert, and he was the one who in 2004 developed this marker of fatty acids analysis like a coronary heart disease marker. Okay? And we know, and this is a new publication 2021, that low omega-3 index is very strong predictor of early death, similar like smoking. So be very cautious, don't smoke first, and second thing, please don't have a low omega-3 index. How do you know what is your index? You just prick your finger, send a sample to the laboratory, and then you know. So how do we know that what we do is really effective? We know it because we test it from the blood. There is no question about this measurement because it's a blood testing. So balance all concept ready. Do we have any evidence? Yes, of course. If you take 0.2 ml on your kilo weight, then you will achieve green numbers in only 120 days. Is it safe? 100%. Why? Because even very high authorities like EFSA is saying that up to 5 grams of omega-3 on daily use is quite safe, even for people who are taking medicines. So we know that the amount what we give you is not any risky for you, and it can only benefit you. So what are the studies? In 2014, we've done and run studies with placebo and actually Zinzino Balance All 1 over the placebo. So we know it works very, very well. Do we know that what we do is correct? Yes, we have all the certification needed. Those were the first tests which clearly showed us that if you use balance oil in comparison with other omega-3 products or without taking any products, just living your life, always balance oil won over those two other groups. Okay, and this is not a small number, it's almost like out of 500,000 tests analyzed. What we also know that there is a correlation between omega-3 index and right balance between omega-6 and omega-3. So it's very simple and easy, just increase the omega-3 index and your balance will be perfect. So what do we know extra? We know that if we have a high omega-3 level or low, we also have much better results with the other ones. So they are supporting with each other. We already proved our concept with the metabolism. We proved our concept with the tests, what we have done. And we actually proved that infections and injuries can be managed in better way, in faster way, the recovery, if you have higher omega-3 index. Okay, it's scientifically proved. So if you are worried, if you have injury, if you have infections, or if you are, in the state that you want to prevent, this is very good way how to do it. Already proved. For fever, red rash, pain, poor general condition, we already know that this is highly effective. Okay? Then we also know that there is a mood consideration. In healthy people, there was a study 2005 and 7 with professors like Angela Rizzo and Bruno Berra on healthy people, that if they improve their ratio omega-6, omega-3, they balance themselves, the anger, anxiety, fatigue, depression and confusion improved, and also energy level increased. Okay? Also, the attention improved, so you can focus much longer. It's my case too, I improved in that well, and hyperactivity is lowered. There was a study about Alzheimer's disease, dementia, cognitive functions like a memory loss, a neurologic confusion and some difficulties, and they were improved significantly when the balance has been achieved. Okay? Type 2 diabetes, there are participants from UK Biobank, and there was a very significant improvement for people with diabetes type 2, asthma, blood pressure. So we know balance concept really work. What to do? Take the dry blood spot test, use the world-class laboratory to analyze, and use a safe dietary supplement full of science to support your healthy aging. I think that with all of this, it was very clear. Balance oil is more like a fatty fish. So it's like a food, like a functional food, more than just a supplement. I hope it's clear. Use it well and be very, very healthy. Thank you very much for your attention. Adam Škoda. Bye bye.